Okay, this month we are going to be talking about or advertising vitamin D. Vitamin D deficiency is actually the #1 vitamin deficiency in America right now. Partly because we don't get outside that much. Most activities, most jobs, everything is done inside. And it gets worse particularly in the winter. So one of the main things that vitamin D contributes to or can cause are things like depression, seasonal affective disorder. It can affect your muscles, affects how your bones heal and regenerate. Of course, leading to things like osteoporosis, affects the muscles. Again, atherosclerosis, which then can lead to heart problems, affects the pancreas, kidneys. All those things are huge, and your body just can't live without vitamin D. About a year ago, I tested my blood to see where I was on the scale, and it was actually kind of interesting because I was just still slightly deficient, and I still take quite a few supplements. And so anyway, it got me realizing, like, well, geez, if I'm deficient and I take supplements, the rest of the population has got to have some sort of problem with that. But a lot of cool things can happen when you take vitamin D. Again, basically taking vitamin D helps prevent atherosclerosis, the hardening of the arteries. It can affect seasonal affective disorder. Those of you who know that, it's called SAD, and because during the winter months you're not out as much, there's not as much sunlight, and so people get that type of depression, and it does, I mean, it's traumatic. The other thing it does help with in the winter is colds and flus. Because we're inside all the time, we're not getting enough vitamin D. Vitamin D does boost the immune system. New England Journal of Medicine, I believe, did a study on vitamin D use and vaccines in people over the age of 60. And what they showed was that vitamin D was actually more effective at preventing colds and flus than the flu shot itself. So very startling and very interesting information. Vitamin D, again, when combined with calcium, is essential for bone growth and to prevent bone deterioration. So then a lot of people also have the question of, well, how much vitamin D do I need? Research has shown that about 5,000 IUs is necessary just to maintain. Now, if you're deficient, you probably want to take a little bit more, but I still caution you with that. If you think you have a problem, it's suggested that you definitely get your blood checked for your vitamin D levels before starting on high doses of it, anything over 5,000 IUs. But 5,000 IUs, we have, it's simple and cheap. It's a little tiny white pill that you take once a day. So if you're getting a multivitamin and you think you're taking enough vitamin D, double check it. It has to be at least 5,000 IUs. Very few multiple vitamins have probably 1/10 of that. So double check your vitamin D dosage and usage, and if you want to boost that, particularly during the winter months, definitely stop in and see us and we can help you.